Cerebrovascular accident, CVA or stroke. My name is Mary Kurzals, and this is Structure and Function of the Human Body. What exactly is a cerebrovascular accident? Well, a blood clot blocking a vessel hampering the flow of much-needed blood from feeding the brain. It could be a blood vessel that ruptures directly in the brain. Either scenario is going to cause brain cells to die. A lack of oxygen can kill brain cells. This is what a stroke is. There are many risk factors associated with strokes. Your medical risk factors such as heart disease, high blood pressure, high cholesterol, diabetes, and obesity. You have your uncontrollable risks, such as age. Well, none of us can stop aging. 50 years old, a person's risk of having a stroke doubles. Gender is a risk factor. Women experience more strokes each year than men as women live longer. Strokes often happen at a more advanced age, therefore women have a higher risk. Race and ethnicity. African Americans have a higher rate of high blood pressure, diabetes, and obesity, therefore it increases their risks by twice as much as Caucasians. Family history. If you have a parent, grandparent, or a sibling having had a stroke at an early age, it's going to increase your potential risk. Medical risk factors such as a TIA or fibromuscular dysplasia. Fibromuscular dysplasia is a medical disorder where the arteries that carry blood throughout the body do not develop normally. Fibrous tissue grows in the wall of the arteries, causing them to narrow. As a result, you're going to have blood flow through the arteries decreased. The TIA I mentioned is a brief episode of stroke-like symptoms that can last for a few minutes to 24 hours. Usually there's no permanent damage or disability. Your lifestyle risks are poor eating, smoking, drinking, lack of activity. You can visualize the two different types of strokes, your ischemic stroke and your hemorrhagic stroke. Your ischemic stroke is a blood clot, and with that blood clot in the blood vessel, it's going to keep the blood flow from getting into the brain. Often this can be treated with medications, thrombolytics, clot busters. Once that clot is removed or dissolved, it can be surgically removed depending on where it is in the brain. It will then open the flow back up and you're going to have a minimal amount of damage. The more serious of the two is the hemorrhagic stroke. It's one of the deadliest types of strokes to occur when a defective artery in the brain bursts. Damaged artery bulges into an aneurysm and then bursts. Blood leaks into the brain tissue. Some of the brain cells are damaged by the blood and the oxygen deprivation. Pressure can build up in your head, and that's going to cause brain damage. It can also lead to death, depending on the amount of bleeding that occurs. There are many consequences associated with a stroke. As I truly believe the brain is the powerhouse of the body. It affects everything. If your brain's affected, it's going to take its toll everywhere. It's going to kill brain cells. It'll affect your digestion, impair your memory, your bodily functions, swallowing. With swallowing, you may end up having to have surgically a tube placed in your abdomen to feed you. Circulation problems, depression, balance, equilibrium, weakness, anxiety, and mood swings. Your bladder control, that's part of your bodily functions. You could have left or right side paralysis. And with paralysis, it could lead to muscle atrophy. It could affect your organ functions. You have a higher risk of future strokes. There are painful treatments that are associated with strokes. There's debilitating medications. You could have problems oxygenating. With strokes, there are many signs and symptoms to watch out for. If you want to avoid the consequences of a stroke, perhaps you should take note of the signs and symptoms. What is thought to be a headache or a slight confusion could actually be the less severe TIA. TIA is serious. It could be a warning sign that the more serious stroke may be in the immediate future. According to the Harvard Health Publications, Harvard Medical School, patients that experience a TIA have a 1 in 10 chance of having a major stroke in 2 days after the TIA. And the risks of that happening are elevated for months. Some signs and symptoms of a stroke are facial drooping. One side of the face could go slack. The smile may appear uneven. You could have one arm that is weaker than the other. When raising both arms, one may not be able to maintain elevation. You could have numbness, loss of feeling on an entire side of your body from your face to your toes. Difficulty with speech, unable to express in words or slurred speech, dizziness, loss of balance, sudden severe headache. Never brush off the signs of a stroke, especially if you're in one of the risk groups. There are many treatments. It's just a matter of strokes are preventable. Early detection. Visit your doctor regularly. Manage high blood pressure. If you have a cardiac condition, make sure that you take care of that. If you have a family history of strokes, you need to inform your doctor that there is a history. Therefore, they know what to watch out for. Eat right. Exercise regularly. Don't smoke. It's always good to make good choices. Stroke is a leading cause of serious long-term disability. There are many debilitating effects of a stroke. Know your risks. Stay healthy. Again, my name is Mary Kurzals, and this is Structure and Function of the Human Body. Thank you very much. I appreciate your time.